Welcome to this comprehensive guide on conducting a safe, effective and patient-centered 15-minute consultation within the NHS. My name is Camille and I'm one of the co-founders of Pareto Education, delivering high-quality clinical resources for the modern clinician. No matter what role you're playing within the wider MDT in primary care, this video will walk through each stage of the consultation, from preparation to meet your patient, to communication, management and safety netting. The aim is not just to work faster, but also to work smarter and more effectively within the time available of a busy general practice clinic. Let's begin with one of the most overlooked but valuable parts of any consultation, which is the preparation. Before the consultation starts, you should spend a minute just to prepare for it. It might seem a minimal or insignificant piece of time, but this is very, very important. Start by reading the triage notes. These are left by the reception staff or other clinicians, and work through the consultation. The triage notes normally give you the initial reason for the contact with the patient. What was the reason for the patient requesting an appointment? Was it chest pain? Was it follow-up for blood pressure control? Is it a routine review of diabetes? Knowing this upfront does definitely help focus the conversation and avoid any unnecessary detours. The next step should be assessing the patient's medical record. Look at the recent consultations, the problem lists, current and past medications, any allergies noted, and any flagged diagnoses. Also, take particular care with any chronic diseases that might influence your interpretation of the symptoms. Here's an example. If a patient takes lithium regularly, a complaint of nausea may carry more significance compared to a patient who's not on regular lithium. It's also crucial to glance at recent blood tests, any imaging or hospital letters that are relevant. Use the shared care record or the document viewer to view any recent discharge notes, ongoing outpatient care or cross-specialty communications. If the patient was recently seen in hospital or by a specialist, your management may need to align or build on that previous plan. A quick scan of this information can prevent duplication, missed red flags, or overlooking any important context. Preparation, remember, is not time wasted. It's an investment into your patient's healthcare. So, during your consultation, remember, we're trying to aim for 15 minutes here. You should be clear, focused, and patient-centered. Remember, once they're in the room or connected via phone or video, it's important to start developing that patient-clinician rapport with an open-ended question. You should start with a warm smile and a friendly tone and introduce yourself. Allow the patient to talk, but try and guide them within the constraints of the consultation. You can use the ICE framework: ideas, concerns, expectations. These three prompts can unlock the patient's underlying agenda, including the emotional and psychological layers of the consultation. For example, ideas. Have you any thoughts of what may be going on? This helps understand the patient's narrative and builds the rapport and anticipates any previous misunderstandings. Concerns. Is there anything that you're particularly concerned about today? This allows you to uncover any hidden fears like anxiety about health such as cancer, or worry about family or work. Expectations. What were you hoping we could do? This helps align your management plan with the patient's goal and addresses any unrealistic expectations early on. These questions may only take a minute or two, but they save time by focusing the consultation on what really matters to the patient and what's safe and appropriate for you as a clinician. Remember to listen actively to the patient. Avoid the temptation to interrupt or guide them too narrowly during the consultation. Patients typically will stop talking within a 60-second golden minute period. During this time, you can mentally note or jot down any key symptoms or timelines if that helps you stay on track. So once you have a good idea of the background or the history presenting complaint of the patient, it's time to clinically assess and examine. During this time, you should think about how you're going to examine and what system. For telephone consultations, this might be a symptom clarification. For face-to-face visits, you should proceed with the focused examination of whichever system is the most important. Don't feel the need to examine everything, but ensure that you examine whatever is necessary to rule in or out your differentials and any red flags. For example, if a patient presents with a cough and a fever, but otherwise well, a basic chest exam may be all you need. However, this comes with practice based on what you need to include and not include in your respiratory exam. If you're starting out new, you would focus on trying to take a more comprehensive examination. If they have breathlessness or a high respiratory rate, you may go further with pulse oximetry or ECG. Remember, basic observations are important and they can help you on documentation safely with the patient. If you are doing a medication review or chronic disease review, you may not need to examine at all. Your assessment is in the numbers and the narrative. Management planning. This should be collaborative and clear with the patient. So once you've gathered all your information and reached your potential diagnosis, start thinking about making a plan. Make sure this is clear, concise, and inclusive. You could say something like, from what you've described and based on my findings, I believe this is likely to be whatever condition. And here's what we propose we do next. You can break this plan into manageable parts. For example, step 1, we can trial medication or conservative management. Step 2, perhaps think about some investigations, blood tests or an X-ray. Step 3, safety net the patient, what to look out for and when to come back. Remember, you can use modern technologies such as messaging to send links to relevant patient leaflets, lifestyle advice, and safety netting information. It is quick, traceable, and far more convenient than printing a lot of paper in the room. Here are some real-world tips for maximizing your time and safety in a consultation. We can recognize that sometimes a problem is more complex than a 15-minute slot can accommodate. And that's okay. You're not expected to fix everything in one go. You can say something like, this is important and I want to give it all the attention it deserves. I propose that we book another appointment so we can follow through properly. This is especially important when multiple issues are brought up or when significant mental health concerns emerge midway through. It is important to advise your patients that only a single problem can be seen in one appointment in order to ensure that adequate time is given to exploring the symptoms and issue at hand. If a patient presents with multiple issues, then you can say something simple such as, I can see you're worried about a lot of things. Out of these, which ones are you worried about the most? If you know the patient needs an interpreter, book a double appointment ahead of time. Translated consultations take longer, and giving yourself the space ensures you don't compromise on quality or safety. If the issue is not urgent or requires specialist info, use your practice's workflow tools to pick the patient with the right person, whether that's a GP for joint injection, a nurse for blood pressure monitoring, or the admin team for referral coordination. Documenting and closing the consultation. Before you finish, make sure that notes are accurate and defensible. Use appropriate coding, especially for chronic disease, safeguarding issues, and safety netting. Templates can help, but don't let them override clinical sense. Finally, you can summarize. So today we've talked about your symptoms, we've made a plan, and I'll send you some information to read. I've also documented what to look out for and when to get back in touch. You can let them ask any final questions and end with reassurance and not dismissal. Our final thoughts for today. Conducting a 15-minute consultation in the NHS is both an art and a science. It does require some practice, preparation, structure, empathy, and efficiency. But above all, it requires clarity of thinking and clarity of communication. These consultations don't have to be rushed even when time is short, and you need to focus on what matters. Remember to be kind, but stick within your boundaries of professional matters. And remember, sometimes the most valuable thing you can offer a patient is simply to listen to them, explain clearly, and follow up responsibly. Don't forget that during this time, you are expected to examine a patient, document, and even send a referral. Ensure you have time to complete your tasks as to not overwhelm yourself. So those are our tips for a 15-minute consultation. Thank you very much for watching. I hope this helps you bring more confidence into your consultation room. Please like and subscribe, and we'll share more videos soon covering everything from clinical reasoning to managing uncertainty in practice. Thank you, and we'll see you on the next video.